Hi, everyone. Thank you very much for joining us today. I'm just going to wait an extra minute or so before we get started to allow for the few stragglers that might be joining. As you can see on this slide, we are on social media, so please feel free to connect with us there. I don't post too often, but when I do, it's usually some useful information, or if we're going to be at a conference. So if you want to come and actually check out our booth and our devices, we would love to connect with you there. And then we're going to be having some information put into the chat. So please look there for some links. You can also put any of your questions into the chat, and we will pause halfway through and then at the end of the webinar to answer any of your questions. You'll also have our information, so you can always reach out to us directly if you think of a question tomorrow or something comes up in a week, a month, a year, whenever it might be. All right, well, I'm going to go ahead then and get started. So again, here you see our social media links. Please feel free to connect with us there. Let me go ahead and introduce myself. My name is Sarah Schumann, and I'm a speech pathologist. My current role is as Director of Education and Outreach for Cranial Rehab, a small medical device company out of Denver, Colorado. I will be presenting today with Elizabeth Lipton-Daly, a practicing speech-language pathologist, Executive Vice President at E2 Scientific, and if that wasn't enough, she's also the Executive Director at the National Foundation for Swallowing Disorders. Again, please feel free to chat us any questions that you might have during the webinar. Following the webinar, I will send everyone an email with information and links to our products. I'll also show a link later on in the webinar that you can use to receive a certificate of attendance. So you'll go to that link and you'll log in and you can sign up and get that certificate that you can use for your certificate maintenance hours. Just to be clear, those are not CEUs. You can Google the difference between certificate maintenance hours and CEUs, but if you have any further questions, you're also welcome to reach out to me. All right, so the goal of this webinar is for you to understand the relationship between tongue strength and swallowing, understand the potential benefits of tongue strengthening in dysphagia management, recognize biofeedback tools designed to help increase tongue strength, and understand how to assess one's tongue strength and determine appropriate exercise programs. Dysphagia is a symptom of a swallowing dysfunction that occurs between the mouth and the stomach, and it affects a very diverse population. Signs of a swallowing dysfunction may include drooling, inability to maintain lip closure with foods or liquids leaking from the oral cavity, poor oral management, food or liquids remaining in the oral cavity after a swallow, food or liquids leaking from the nasal cavity, complaints of food sticking, globus sensation, or complaints of fullness in the neck. A patient may also experience coughing or choking. Dysphagia often contributes to increased risk of malnutrition and aspiration pneumonia. So just a quick review of some of the signs and symptoms to be aware of and a little checklist you can use with your patients. These include wet sounding voice after a swallow, hoarse vocal quality, coughing, gagging, choking when swallowing, throat clearing or multiple swallows to clear food while eating, sensation of stuck food in the throat or behind the sternum, pain when swallowing or an inability to swallow, drooling, dry mouth or throat, regurgitation of food, heartburn, weight loss, avoidance of foods or certain foods, eating smaller bites, and also prolonged meal times. I'm sure you've all heard this before. However, I cannot stress it enough. Swallowing is a use it or lose it function. Speech therapists have a very important role to play in the evaluation, diagnosis, and treatment of dysphagia. By helping prevent and treat dysphagia, therapists can currently address dignity issues and improve a patient's overall quality of life. The tongue plays an important role in swallowing. During the oral phase, food is masticated and mixed with saliva to form a soft consistency called the bolus. The tongue helps manipulate and form the bolus and then moves it posteriorly in preparation for the swallow. If any part of the process is disrupted, it may lead to dysphagia. So how does tongue strength come into play here? Well, reduced lingual strength may result in poor bolus formation, premature bolus loss, decreased tongue to palate contact, and prolonged oral transit times. Some research has concluded that tongue strengthening exercises can help improve swallow safety and dietary intake for patients with oropharyngeal dysphagia. However, recent well-controlled clinical trials have shown variable results in changes to swallow physiology and airway safety, despite demonstrating increases in tongue strength. Overall, the impact of device-facilitated tongue strengthening exercise is mixed. More research, particularly prospective, randomized controlled trials with large homogeneous patient samples, are needed to better support the use of device-facilitated tongue strengthening in various clinical populations. Nonetheless, there are a few studies in the works, and hopefully we will have results for you soon. Now, to give an example within a specific population, here is a study published in 2015 that looked at reduced tongue strength and its potential effects on head and neck cancer patients. The researchers concluded that reduced tongue strength is an important factor contributing to early and late dysphagia in head and neck cancer patients previously treated with chemoradiotherapy. There is growing evidence that tongue strengthening exercises can improve tongue strength and swallowing function in this patient population. Due to lack of access of methods to collect objective data, many speech therapists have resorted to using oral mechanism exams to establish tongue strength capabilities in patients. However, the issue with using an oral mech exam to quantify tongue strength is that it is subjective and not always consistent across evaluators. Especially in our current healthcare system, it is important to provide objective data and documentation in order to validate need for services, demonstrate progress, and support insurance coverage. Having an objective way in which to measure tongue strength can help the clinician determine if tongue strength is reduced compared to that of healthy adults, providing a therapy target. Objective measures of measurements of tongue strength allow the clinician to determine whether weakness may contribute to swallowing disorder, determine the most appropriate plan of care and treatment program, and lastly, objectively measure and document progress to support treatment justification. One of the most well-known devices for measuring tongue strength is the IOP. Using the IOP in healthy adults, maximum tongue strength was found to fall in the range of 40 to 80 kilopascals, with an average of about 63 kilopascals. Tongue strength in older adults is somewhat lower than younger adults, averaging around 56 kilopascals. There is considerable variability in tongue strength in healthy adults. The majority of adults have maximum tongue strength greater than 34 kilopascals. As of this year, there have been 2 publications comparing concurrent validity, that is the agreement, between the measurements using the IOP and the tongueometer. Both of these devices are lingual manometers that use biofeedback and are capable of assessing and exercising tongue strength and endurance. The first of the 2 studies published came out from Dr. Ashwini Namasyam's McDonald's lab. There were 3 aims of this study: to confirm concurrent validity, that is the agreement of the tongueometer to the IOP using a large sample of healthy adults; to collect comparative tongueometer reference values of maximum anterior, posterior, and swallowing measures; 3, to investigate associations in age and sex using the tongueometer to compare to trends in the literature. They found that the tongueometer demonstrates preliminary concurrent validity when compared to the IOP. Trends in tongue pressure, as measured by the tongueometer, are consistent with those reported in the previous literature. Mean posterior and saliva swallow pressures were different, which may be related to differences in the bulbs. But overall, the results support use of the tongueometer as a valid tool for measuring static and dynamic tongue pressure. Trends are consistent with the results in literature using other lingual manometers. The second of the 2 studies published was by Dr. James Curtis. The purpose of the study was to compare pressure readings between the IOP and the tongueometer in a controlled laboratory setting. The reason for performing the experiments in a lab setting is to remove human variability, which may confound results. Humans are inherently variable in their performance of any movement task, and while a randomized study design should mitigate this, performance viability cannot be ruled out. There were 3 experiment designs that were completed as part of this study. Experiment 1 compared the full setup of IOP to the tongueometer. Experiment 2 compared the IOP bulbs to the tongueometer bulbs while controlling for manometer. Experiment 2 also compared the IOP and the tongueometer manometer, removing the bulbs from the, experiment 3 compared the IOP and the tongueometer manometer, removing the bulbs from the equation. Results of the study can be found online. The author has provided an open access copy of his website, but to summarize the conclusions, there was a substantial level of concurrent validity, so agreement, between the devices, though not perfect. The disagreements in pressures with low ranges may be related to differences in manometer, where disagreements in high pressures may be related to bulb differences. This study supports use of the tongueometer in clinical practice as a low-cost alternative. However, readings do not align perfectly, so correction factors should be considered, and these are described in more detail in the paper. All right, so let's quickly touch upon dysphagia biofeedback. First, what is biofeedback? Biofeedback is a mind-body technique patients can learn to control some of the body's functions. Most biofeedback tools are non-invasive and may utilize visual, auditory, or tactile output to provide the patient with information regarding their performance. In regards to tongueometer strength, biofeedback devices may be used prophylactically to help prevent tongue weakness or delay weakness. They may be used during an initial evaluation to assess function and determine if tongue weakness relates to swallowing dysfunction. They may also help monitor disease progression, and they support progress during therapy. There are 2 different factors that should be considered during an assessment. Strength is the maximal amount of focus that is exerted. Tongue strength is measured by evaluating how hard a patient can push with their tongue against the roof of their mouth. Endurance is a maximal amount of time a submaximal force can be maintained. The submaximal force is typically considered to be 50% of maximal strength. For example, if your maximum tongue strength is 50 kilopascals, then to measure endurance, we would see how long you can sustain that hold at 25 kilopascals. Swallowing is a submaximal strength task. To improve overall lingual capabilities, clinicians will create a therapy exercise program utilizing both repetitive strength and isometric endurance tasks. Using the principles of exercise science, the therapist will help the patient determine the target pressure range for completing exercises based on the patient's maximum tongue strength. The range is typically set as 60 to 80% of the patient's maximum pressure. For isometric endurance tasks, the therapist will help the patient determine the targeted length of time to hold an air-filled bulb against the roof of the mouth with the tongue within a set pressure range, typically above 50% of max strength. There is some research on healthy adults that shows that exercising either the front or the back of the tongue may result in increased strength in both the front and the back. However, when it comes down to it, we need more research to determine and establish the best protocols for general and specific therapy targets. It is up to the clinician to determine an appropriate exercise regimen. We are here to help provide guidance, but we do not have evidence-based strengthening protocols to give you. Nonetheless, I will mention that the Tongueometer user manual does provide sample protocols. There are ongoing studies using the Tongueometer and other biofeedback strengthening devices to determine the best dose, frequency, and intensity for exercise regimens. To give you an idea of potential protocols, we will look at the protocol used in the Robin study. The researchers found that lingual exercise enables acute and chronic dysphagic stroke patients to increase lingual strength with associated improvements in swallowing pressures, airway protection, and lingual volume. However, please keep in mind that this was a very small study. The study looked at 10 stroke patients across an 8-week tongue strengthening program. The baseline maximum pressure was measured as the highest value from 3 measurements for each area. The protocol was established at 3 times a week, 3 times a day, with 10 repetitions of the interior and 10 repetitions of the posterior areas in each set for a total of 20 repetitions. During the first week, the therapy target was set to 60% of baseline max pressure. For weeks 2, 4, and 6, the baseline was reassessed and new target was set to 80% of the newly assessed max pressure. Now, to give you an idea of a potential endurance protocol, we will look at the protocol used in the Robinson study. In this study, 2 ALS patients participated in an 8-week lingual resistance training program. So again, keep in mind that this was a very, very small study. For the protocol, the baseline was set as the highest of 3 max strength trials, which targeted only the anterior portion of the tongue. The exercises were completed 5 days per week, with 1 set of exercises completed each day. The set included 4 different exercises, with one of these exercises focusing on tongue endurance. The target goal for the tongue endurance task was set at 20% of maximum tongue strength. The patient completed an endurance hold, then rested for 1 minute. They repeated this for 5 times total. During week 1, the target was a 6-second hold. During week 2, it was an 8-second hold, and then the hold increased by 2 seconds each week up to week 8. Participants were given the option to hold for 2 seconds less than the target time for that week if they found the task to be too taxing. It is very important when developing a protocol to consider your patient and use your clinical judgment. Do your best to personalize the protocol to your patient. Keep in mind the cognitive status or need for assistance of your patients. Furthermore, keep in mind how often are you as a therapist able to monitor and support your patient, adjusting the protocol as needed. Also, is your patient highly motivated? If so, higher targets may be appropriate. Is your patient feeling overwhelmed? If so, then you may want to provide easier to achieve targets. All right, so I'm going to take a quick pause here. As you can see on this slide, we have that link that you can use to go ahead and request the certificate. There'll be a short little survey, so just quickly fill it out and we'll send you the certificate of attendance. So just jot that down if you need that, and that's what you'll use to get your certificate. I'm also going to pause here to see if there were any questions yet. The next section will move on and look more in depth at the tongueometer device itself. All right, let me see.
No questions yet.
No questions yet. All right, you guys are making it easy. So I'm going to go ahead and move along. If anything comes up, chat it to us and we'll have time at the end. Rob, go ahead and unmute Elizabeth.
Wonderful. Excellent. I think you should be able to hear me now.
Yes.
First of all, I want to thank Sarah for her excellent overview of the tongue's important role in swallowing. And now we'll transition to describing a tool that you can use in your clinical practice to measure and exercise tongue strength and endurance. So in this next section here, we'll take you more in depth on how to use the tongueometer device as an additional tool in your dysphagia toolkit. So we will cover the topics listed here, including what the tongueometer device is, how it works, the benefits of using a device that provides this type of biofeedback, and then we'll have plenty of time for questions at the end of the presentation. So feel free to submit your questions at any point using the chat feature throughout the presentation here. So for those of you who may not be familiar with the tongueometer device, the tongueometer is a fairly new lingual strengthening device that's designed to measure and exercise tongue strength and tongue endurance. It can also be used to measure lip strength and lip endurance as well. The handheld device includes a replaceable textured air-filled bulb that a user applies pressure to using their tongue, pressing it up against the roof of their mouth. The tongueometer pairs using Bluetooth to a free downloadable app that's compatible with both Android and iOS smartphones and tablets. The app shows, stores, and can also send all of your exercise and assessment data remotely. The app can be downloaded on as many devices as you would like without needing to purchase a device. So if you would like to download the app right now on your phone or tablet as we go through this presentation, you're welcome to do so. And then in this next section here, we'll take you through a short video demonstration of how you might use this device as part of an assessment and then setting up a treatment program for a patient. So in this video here, you'll see Ed Steger, who is the co-creator of the Tongueometer device. He's also a head and neck cancer survivor with severe dysphagia, and he'll play the role of the patient in this video, and I'll play the role of the clinician. So we'll go ahead and get that started here. For today, we're going to have Ed demonstrate how you might use the Tongueometer device as part of your swallowing assessment and then part of your swallowing rehabilitation. So if Ed were coming into the clinic today and you wanted to assess his tongue strength, you would have him open the application on his phone or the clinic's phone or tablet to the maximum strength module, which looks like this on the screen. And then you would instruct the patient to place the tongueometer bulb in their mouth. You can either have them exercise the front part of the tongue or the back part. So for this exercise here, we'll have Ed exercise the front part of his tongue. So the bulb is placed close to the lip guard. He places the bulb in his mouth and then presses up against the roof of his mouth using only his tongue. The application measures his tongue strength in kilopascals. So that's how much pressure he's applying to the bulb and pressing it against the roof of his mouth. So as you can see here, his maximum was 13.1 kilopascals. The application shows up to 60 kilopascals. The device itself is able to measure up to 100 kilopascals. So once you assess somebody's maximum strength, you might want to assess their maximum endurance. So how long can they maintain that pressure for? So to do that, you swipe over to the next module here, which says maximum endurance. And then you can set that target range, that blue highlighted section. And you might want to set that around 50% of somebody's maximum strength. This is patient specific, based on your clinical judgment, whatever you think is best for that patient. So Ed has set the highlighted range here. And now I'm going to instruct him to hold the pressure in that highlighted range for as long as he can. So as soon as it gets into that highlighted range, the timer starts counting. Underneath the meter, it shows how much pressure he's applying. So right now, right around 7 kilopascals, and he's held it for at least 12 seconds. If it dips underneath that blue range, the timer stops. If it goes over the blue highlighted range, the timer continues. So here for this exercise, you can see that Ed's maximum endurance is 16.9 seconds. So based on that information, then you can set up a patient's exercise program. There's 2 modules designed for exercise. And if you swipe to the left on the app, you'll get to the first one here. So if you go over, Ed, to the repetitive strength, here again, you can set that highlighted range to whatever's best for that patient. Some exercise programs have you set it between 60 and 80% of your maximum strength. Again, patient specific, whatever's most appropriate for that patient. So here Ed has set that highlighted range. And now I would instruct him to perform, let's say 10 repetitions where he's trying to hit that highlighted range. Each time he gets into that target, it counts as 1 repetition. At the bottom is the counter. So it shows you how many repetitions you have performed. For an exercise program, you might have a patient do this a few times a day, and you can assign them the number of repetitions that are most appropriate for them. If you have a patient that is very motivated, you might want to set the highlighted range a little higher. If you have somebody that needs that extra boost of encouragement, you may want to set it a little bit lower so that they're more successful with their exercise. The other exercise module here, Ed, if you swipe to the right, this endurance exercise. So this one, similarly, you set that target range to whatever's appropriate for the patient. And then the second part of this is you set the number of seconds you want them to hold that pressure in that highlighted range for. So for this one here, we'll have Ed set it to maybe 5 seconds. All right. And so here you instruct the patient to place the bulb in their mouth, press it against the roof of their mouth, hold it in that highlighted range for 5 seconds. Once it gets into that highlighted range, there's a blue timer at the bottom that starts counting the seconds. Once he's held it there for a full 5 seconds, it counts as a repetition, which is the number inside of the circle. So now he's at 2 repetitions. And again, you can assign the number of repetitions that you feel is appropriate for that patient.
Oh boy, that's quite a workout for my tongue.
Yeah, you'll start to feel that. Absolutely. And then Ed, if you want to see how you're doing with your exercises, if you click on that data button up at the top, the square with the arrow, it will show you how you've done your exercises for that day. You can also take a look to see how you've been doing for the week, the month, the year. If you click on the button that says today, it will give you those options for how you want to see your data. And then also, if you wanted to reset the data, if you were using a shared tablet or phone in the clinic and you didn't want to carry over that exercise data to another patient, you can click reset and it will prompt you with a pop-up that says, are you sure? Once you clear all of the exercise data, you can't get that back. So be careful when you press that, make sure that you want to. If Ed wanted to share his exercise report with me remotely, he can do that directly from his phone. And there's two options. You can click that email button. And again, that shows a pop-up here that says that you're sharing your data report. The information that's included inside the report is the date of your practice, and then each repetition that you performed and how much pressure you applied, the length of time you held the report for. And once you click the email, it will pop up here, and you type in the email address to whomever you wish to send it to. And there's a pre-drafted template for what the email says. It's just going to send that to our company account here. And what's attached is a CSV file that then the clinician can open and look to see how the patient has been performing their exercises. There's also an option within the app to share this through other ways instead of email. So if you click the share icon, the three dots there, again, it prompts you to make sure that you want to share your report, but then it pulls up different options. So if you wanted to share it through an app called Box, similar to Dropbox, you could do that. If you wanted to WhatsApp your data report to somebody, you could do that as well. So just different ways to share that exercise report. Today we'll introduce you to the tongueometer device.
Always gives me a hard time.
No worries. Thanks, Sarah, for playing that. I appreciate it. All right, so moving on here, let's talk a little bit about who the tongueometer device is meant for. So the tongueometer device can be used to assess lingual strength in just about any patient. It's most commonly being used right now with patients that have had stroke, head and neck cancer, and neurodegenerative disease. There are a few contraindications for using the tongueometer with patients, and that includes patients with TMJ, active uncontrolled seizures, and with children who are under 3 years old. We strongly encourage that the clinician consider the patient's cognitive status when using the device, so making sure that they're able to understand directions for taking the bulb out of their mouth and how to press on the bulb. When using the device with children, it's recommended that they have close supervision, either by a clinician or a trained parent or caregiver. There has been a study using a similar device that shows that typically developing children as young as 3 are able to understand directions for using a device like this. So, as described in the video, the Tongueometer app offers 2 modules for assessment, one to assess the patient's maximum tongue strength, and then another one to assess their maximum endurance. So again, you can use this also to measure maximum lip strength and maximum lip endurance as well. One of the nice features about the tongueometer device is that you can adjust the length of the tubing on the bulb to exercise either the anterior portion, so the front part of the tongue, or the posterior portion of the tongue. The tubing of the bulb is thread through this white circular lip guard, and that's designed to prevent a user from placing the bulb too far back in the oral cavity, but also designed to hold the tubing tightly in place so that the bulb is placed in the same depth, at the same depth in the oral cavity each time. To assess a user's maximum tongue strength, you would prompt them to place the bulb in their mouth, push up against it as hard as they can using only their tongue, and then release. The app will record and show the highest pressure, again, measured in kilopascals. If you feel like a patient is using their jaw to apply additional force on the bulb, maybe you're getting a higher reading than what you're expecting, you can cue them to imagine that they have a pencil placed between their molars and to use just their tongue to press up against that bulb to avoid clenching. So as the clinician, you might have them perform 3 to 5 different trials, recording the highest reading as their maximum strength. Some clinicians will average the readings over the trials. Oftentimes after 5 measurements, a patient might start to fatigue. We encourage people to rest in between the trials. Most of the research is having patients rest for at least 20 seconds in between each maximum press. And then once you've determined a patient's maximum tongue strength, you can then go on to assess their maximum tongue endurance. So to do this, there's an option to set this target range in which you want the patient to maintain pressure for as long as they can. So for example, if the person's maximum tongue strength was 30 kilopascals, you may want to set that target pressure around 50% of that, which would be 15 kilopascals. So you could set that highlighted range between 10 and 20 kilopascals using the slider bar on the application. Again, it's always up to the clinician to determine what the appropriate range is for that patient. So once that range is set, and then you instruct the patient to apply pressure to the bulb and then hold it as long as they can in that blue highlighted range. Once the pressure is in that target range, there's a counter on the bottom of the screen that will start counting the number of seconds that they maintain that for. So then once you determine a patient's maximum tongue strength and maximum endurance, you can decide whether they might benefit from using a device like this as part of their rehab program. And so while the reference values are still beginning to be established in healthy adults using the tongueometer, as Sarah mentioned earlier when she was describing the new data that came out between the tongueometer and the IOP device, the IOP does have well-established reference values that you can refer to. And as Sarah mentioned, typically pressures under 40 kilopascals are considered below normal. So while the meter shows up to 60 kilopascals, the device itself is capable of reading up to 100 kilopascals. And we mentioned this mostly for the researchers who are using this. If you're working with a patient who consistently has tongue pressure measures above 60, they're most likely not using this for a home exercise program, but we do know of research studies involving healthy adults where their norms are higher than 60. So that's the reason that those numbers are set where they are for that. Once you've determined that your patient might benefit from a tongue strengthening program, you can determine the appropriate treatment regimen for them using the 2 exercise modules that are part of the app. So the first exercise module is designed to help increase tongue strength through repetitive isotonic exercise. And so for this exercise, the clinician determines that appropriate target range again that you should apply pressure to. You press on the bulb and then you release, and then you repeat those. The clinician can prescribe the number of repetitions and the frequency at which the patient should be performing their exercise. The app shows really nice visual biofeedback, and there's also a counter at the bottom so that the patient doesn't have to count the number of successful repetitions that they've performed. And then there's one last module on the Tongueometer app that is designed to increase tongue endurance. So again, you set that appropriate target range, and then you also set the number of seconds that you want that person to maintain that pressure for. So many clinicians are setting this length of time around 50% of a patient's maximum endurance. So if your maximum endurance was 10 seconds, perhaps you set their exercise program for 5 seconds. And again, that's up to the clinician to determine what the most appropriate values are for that patient. One of the benefits of using a device like the Tongueometer is the biofeedback that it does provide. And there's this option also to adjust the exercise parameters to increasingly challenge the patient. So similar to going to the gym, if your goal is to lift 50 pounds and you start by lifting 5-pound weights and you never increase that amount of resistance, over time, you're less likely to meet your goal of being able to lift 50 pounds. 2 of the newer features that the Tongueometer offers in terms of enhanced biofeedback now include the option to turn on tactile and auditory feedback. So if you're using a smartphone, you have the option of turning on tactile feedback where the phone will vibrate after each successful repetition. And then for phones and tablets, most of them have this capability where there's the ability to turn on an auditory signal after each successful rep, where you'll hear this high-pitched ping. So these 2 newer options are helpful for patients that may have visual impairment and not be able to see the meter as well, but also beneficial for patients who are encouraged by having that extra type of biofeedback as well. One of the nice features about the Tongueometer device that differentiates it from other similar biofeedback devices is the option for patients to view and send their exercise data. So from within the application, users can view their progress report, and with the option of viewing it by the day or the week or the month or even the year. There's also an option on this page to clear all of that data, so to reset it, which is useful if it's a clinician using the same phone or tablet with multiple patients. That way you're not confounding all the data that's collected. Patient also has an option to export their data report remotely with a click of a button. It's helpful here in Wisconsin where I am in the middle of winter and you can't get to the clinic because there's 6 feet of snow on the road that won't be cleared for a few days. So the patient can send their report. It's stored as a CSV file, and they can send that through email or other applications on their phone like Dropbox. The app does prompt the patient that they are sharing their data report. And it does say that it may include PHI, so protected health information with that. If the CSV file, it doesn't include actual personally identifiable information, so it doesn't have your name or your birth date, any information like that. But once the patient attaches it to their email or to their Dropbox account, that's where that information is tied. So it's important for the clinician to store that appropriately. All right, the data report that the clinician receives shows all exercise and assessment data, and it's attached to the date that that exercise was performed. The E2 Scientific website has a free downloadable dashboard template where the clinician can copy and paste the data report to create graphical forms. And the 2 of the graphs will show your progress over time, so changes in your strength and changes in your endurance. And then 2 other graphs will show your adherence to the exercise. So were you doing the 2 exercise modules as prescribed? These reports can be printed, they could be copy-pasted into a patient's electronic medical record, they can be used as part of research. There's a lot of ways in which you can use the data report. So here is an example of a patient's dashboard report. So you can see in the upper right-hand corner, I know it's kind of small to see there, the patient did increase their lingual strength over the course of an 8-week training program. The patient here is a 15+ year head and neck cancer survivor who, as you can see, started his exercise program with severe lingual weakness, so around 14 kilopascals. You can see this slight increase in strength over time. And while this didn't make a meaningful change in the patient's swallow function, the patient did report subjective improvements in their speech intelligibility as well as their speech endurance, where they felt more comfortable speaking for longer periods of time and to a wider audience. Then that person went on, you can't see that from this report here, but they continued to use the device as part of their maintenance program with the goal not necessarily of increasing tongue strength, given the guarded prognosis, but to try to help maintain that tongue strength so that it didn't decline over time. And then one of the most common questions that we receive is whether the tongueometer is covered by insurance. So first of all, at this time, the purchase of the device is not covered at all by insurance. In 2022, we did submit an application to Medicare for a device reimbursement code. However, we're denied. So now in terms of therapeutic reimbursement in 2022, there were new codes that were introduced to now allow for remote therapeutic monitoring, which is a way to monitor and collect data from patients, which might allow clinicians to be reimbursed for more frequent check-ins with their patients and potentially increase adherence to their exercise program, which then hopefully increases therapy outcomes as well. If anybody on this call has experience using these RTM codes, the remote therapeutic monitoring codes, we would love for you to share your experience with us and the outcomes. So to the best of my knowledge, I don't know of anybody who has used these codes with the tongueometer device specifically, but we're hoping to learn more about that. And that brings us towards the end here of our presentation. I just wanted to quickly answer a few of the most common questions that we receive. The device, it can be used with multiple patients as long as the bulb is replaced. And the handheld device, the white part of the tongueometer, should be disinfected according to your facility's infection control policies. The bulbs can be used by the same person for up to 2 months, and you can clean the bulb in between use using a damp paper towel and a mild soap, just being careful not to get any water inside the tubing, so don't submerge the bulb in any type of tub of water. The primary difference between the tongueometer and other biofeedback devices like the IOP is primarily the cost. So the tongueometer is currently available for under $400, whereas similar biofeedback devices, lingual manometers, are upwards of $2,000. The other difference is that the tongueometer bulb is textured, and the reason for that is we wanted to provide some additional sensory feedback for patients using the bulb, and then also to reduce the slippage in the oral cavity with that. Currently, the device is available in the United States, Canada, and Mexico. And for additional locations, you can reach out to Cranial Rehab. They're working to distribute the tongueometer more broadly. So with that here, please feel free to reach out to us if you have questions right now. We'll look through those here, and I'm going to invite Sarah to join us again.
Yes, thank you so much. Okay, so on this next slide, you can see some of the information about ordering. I do want to clarify, purchase of the device is not covered currently by insurance. You can order directly on our website with a credit card, or if your facility is purchasing it, they can use a purchase order and send that in to us. Obviously, the patient is also able to purchase directly on our website or by calling in. So on this slide, you see the product codes for ordering on our Cranial Rehab website, excuse me. You may also purchase the tongueometer device on the E2 Scientific website as well. So these codes that you see here are for the Cranial Rehab website. Now down below, you're going to see the links for Canadian and international ordering. As of now, we're not able to sell to the UK, the EU, or Australia, but it is something that we're working on. So hopefully we'll have some news there in the near future. We do ship to Canada, and as Elizabeth mentioned, we can also ship within Mexico. Okay, so now I'm going to turn it back to see what questions we have that we can answer.
Sure. So the first one is about children's use. And I know you said very small children, but can you talk a little bit more about that?
Yes, so we do know that there are children using the device as part of their rehab for different diagnoses. So I've heard from clinicians that have used the device for pediatric clients that are going through oral myofunctional therapy, whether that's for tongue thrust or posture, tongue tone, strength. Children as young as 3 seem to be able to use a device like this as long as they're able to understand those directions. It's important to consider the cognitive status of that patient. Are they able to follow those directions? And taking a look at any other contraindications too. So for example, if they have seizures, you wouldn't want to use that in a device, use that device with a child that has active seizures. But there are clinicians that are using the tongueometer device. There's a few podcasts from pediatric SLPs that are available if you search online. You can find a link to those on our website too, if you're interested in learning more about how it's being used with pediatrics. Great.
And then we had a question about the usage for suboptimal exercise for like ALS patients. And, do you have some guidance about that so that they don't get too tired out?
Yes. So when I was in grad school, the thinking was that patients that have a progressive neurologic disease like ALS, you would want to not push them as hard with exercise or not even do exercise with patients like this. The trends now in the research are showing that at the earlier stages in a disease similar to ALS or ALS itself, perhaps boosting them up to increase their functional reserve, where you're trying to increase their tongue strength because we know that over time it is going to be reduced. And so there are some benefits if they're able to, at the early course of their disease, depending on where they are in their stages, have them exercise more intensively, and then monitor that as the disease progresses, where, correct, if they're still swallowing, you don't want them to be tired out right before they go to eat their meal. So not having them do an intensive rehab program, especially their exercise program right before they go to use their tongue, whether that's for speaking or for swallowing. But there are trends in the research showing that continuing an exercise program throughout the course of their disease may be beneficial. And again, you want to consider the patient's goals too as well. If that's not something that they that's important to them to work on, perhaps not so much addressing that. But if that is something, if their goal is to maintain their swallow as long as they can through their disease progression, perhaps addressing that more intensively up front would be something to consider.
Great. Okay, and then we also had a question of if there had been any studies about speech improvement from a device like this.
Yes, there is research that takes a look at tongue strength and dysarthria. There's quite a few studies that you can find. What we know is that speaking or speech is a submaximal task. We don't need a lot of tongue strength to speak clearly. I've worked with patients that have hemiglossectomies where they're missing portions of their tongue, or even near total glossectomies, and their speech is still intelligible. We have subjectively heard from many people that use the tongueometer device that as their tongue strength increases, they feel subjective improvements in their speech. And whether a clinician is measuring that more objectively in terms of intelligibility tests in the clinic, I'm not sure, but certainly that's improving their quality of life if they feel that their speech is improved in terms of intelligibility. Research has shown too that increasing tongue strength in patients that have had stroke, for example, and have subsequent dysarthria make improvements in their speech as well. So it is being used as part of a dysarthria treatment by some clinicians.
Great. And then we had a question about the endurance versus the strength, and if you recommend for both of them the 60 to 80% sort of goal for those exercises.
It's a great question. I don't have the best answer for that. Clinicians are setting that at different ranges. There's not a whole lot of endurance research in the literature. And the papers that are available, I'd have to go back and check to see where they're setting that, or if they're setting that, or whether they're just having the patient hold it as long as they can as part of the increase for endurance. So I don't have a great answer to that. Certainly you could set it at the 60 to 80% just to keep it consistent across the two exercise modules. You could set it closer to that 50% range. Again, I would defer to the clinician and to the patient and their diagnosis and prognosis for setting those measures.
Great. And then can you talk a little bit about the cleaning procedure between patients?
Yes. Yep. So with the tongueometer device, first of all, remove the bulb. If you're using it with a patient that's going to continue using the device, they can keep that bulb. If you used it for assessment and that patient no longer needs that bulb, you can dispose of that. But cleaning the white handheld part, we defer to the your institution's infection control department for the best recommendations for that, but you can use a disinfecting wipe. So for example, a cavi wipe, if that's something that your institution approves, to disinfect that, and reading the label on the disinfecting wipe, following those directions, and letting it dry completely before going back to use it again. We do have some instructions on our website and in our user manual that you can find for disinfecting that, but again, double check with your institution as well.
Okay. And then would you recommend measuring all dysphagia patients?
Yeah, that's a good question. So if you were assessing dysphagia in patients, there's certainly no harm in measuring tongue strength. I would say most clinicians are probably completing an oral MEC as part of their dysphagia evaluation, where either they're subjectively or objectively using a device like this, measuring tongue strength and tongue endurance. The nice part about using the tongueometer is that you can have that objective data and compare. Whereas with oral MECs, using subjective measures where we're feeling, pressing your tongue into your cheek, it feels moderately weak. It's very subjective and hard for different clinicians to measure that throughout the course of your treatment, to say, this is the same at the beginning, even for the same person, to measure it at the start and then at the end. Whether you need to use a device like this to get measurements on all patients with dysphagia, I would say perhaps not necessarily. I think it really depends on the cause of the dysphagia. So if you're working with somebody that comes in for a swallow evaluation, their diagnosis is GERD or some sort of, let's say, lower esophageal dysphagia, they may have normal tongue strength. You wouldn't necessarily know that unless you measure it. So there's certainly no harm in doing a full assessment where you're taking objective measures of tongue strength.
Okay. And then can you talk a little bit about how clinics, or Sarah, about how clinics are using this? And then is every patient buying a device?
Sure. Yeah, I'm happy to answer that question. So no, not all patients are purchasing the tongueometer. Some patients absolutely have to have it, and so they do that. Some clinics are ordering a few tongueometers, and they keep one on hand for assessment, and then they have a couple that they use as a loaner. So they loan it out to their patients for the duration of their, therapy, and then after whatever their protocol program is, the patient would have to return it. That would really just depend on what your facility is capable of doing. And then, of course, what your patient is able to afford. So some patients, really, really want to have it, and they save for it, and they purchase it outright. Some have borrowed it from their clinic, their clinician, and some is really just being used more for assessment.
Great. And then the last question was about a return. Oh, here we go. When using the device for several patients, do you have a suggestion of how to mark the tubing so the placement in the oral cavity remains consistent?
Yes, that's a good question. Some people are taking a permanent marker and marking the tubing on the opposite side, so behind the lip guard, to mark that where the patient should be placing the bulb each time. And so that way you can pull it if you're exercising both parts of the tongue, the front and the back, and you want the patient to change the tubing back and forth while they're doing their exercises. You can mark in both locations, or if you're just using it in one spot. If you're using the device, placing the bulb in the same spot each time and not changing the positions, you could even leave the bulb in place in between uses if you have your own tongueometer device with that, and then you could still clean the bulb while keeping it connected to the tongueometer device. But you could use a marker to mark that. I have heard that sometimes the mark will get faded over time. I'm not sure if there's the best permanent marker to use for that, but that would be one option for marking the bulb.
Great. And then the last question was if the device can be returned if someone is unhappy using it, and you cannot. Basically, it goes in the mouth, so it's not something that we can take back. But there is a 1-year warranty on the device. So if there's any issues with the device, the other thing is that, especially if you're, at a clinic and in different ways, you can still just get new bulbs to be able to transition that for another patient there. So that was sort of the end of the questions.
Okay, fantastic. Well, again, everyone, thank you so much for joining us. We really appreciate your time. Please make sure to get that certificate of attendance. Go to that website link there, the craniorehab.com/SLP webinar survey. It's a quick little survey, and then you can get that certificate of attendance. If you have any questions at all, please don't hesitate to reach out to myself or to Elizabeth. We're definitely here to help you the best that we can.
Thank you, Sarah, for the opportunity to join you.
Yeah, thank you for joining me.